Hey, it's Dr. Gile, everybody, here at your local veterinary hospital, and I got asked to answer this question, which I've been getting a lot of for a couple of weeks. You've been seeing this news article, social media, this respiratory outbreak in dogs, and I wanted to touch base with you about what we know so that it will help answer some of these questions that I keep getting every day. Number one, it hasn't been in our state as of yet. It reminds me to remind you to be on our email list. All the local veterinarians here at the hospital are in touch with the state government, right? Our state veterinarian. Anytime we have a reportable problem, a reportable disease, then they reach out to us. And we are your touch point to reach out to you and to try and keep your pet as healthy as possible. So that's the first thing. Be informed, be ready, and be able for us to reach you. You can do that on all of our websites here at the veterinary hospital. Secondly, what we know about this outbreak is that it's not a new isolate. It's not a new infectious disease. We do know that it doesn't respond all that well to treatment in traditional ways, and we haven't been able to isolate exactly what it is, but there's nothing new. Going into the holiday season, we need you to be protected as possible. I know that some of our plans just aren't going to be able to get changed, and our dogs are going to go to boarding. It's not being recommended that you don't go to boarding, but it is being recommended that your dog's completely up to date in as much as we can do. That includes parainfluenza, influenza, and bordetella. Trying to prepare for that. Something else that came up when we were talking about this morning. How can we catch this? We're going to catch this dog to dog, okay? Where are you going to get that? You're going to get that in a grooming shop. You're going to get that in other high traffic areas. That includes boarding, that includes daycare, that also includes like stores that have a lot of dogs in it. If your dog is immune compromised, then we don't want you to be in those areas. Immune compromised or heart disease or some other comorbidity that's going to make this worse. So use your judgment on that. Are you curious on what to look for? We're going to be looking for coughing, sneezing, nasal discharge, and overall just kind of being dumpy after being in a high traffic area. I think I touched on it all. So if you have questions, shoot us an email. If you want to know if you're up to date, shoot us an email. That's it for today.